Welcome to APT Injection Training. This video is intended for APT Injection Training students for educational learning purposes.
Hi, my name is Patricia Pizzano from APT Injection Training, and I want to talk today about how to landmark a cheek. Sit down, just sit down. How to landmark a cheek and do beautification triangle. We're going to assess the patient, and then I'm going to treat with cannula. So when you're landmarking a cheek, the first thing I want to do is I want to locate the apex of the cheek. So the real cheater's way of doing it is big smile for me. Where she flattens out on her cheek is typically the apex. Big smile. Where she flattens out is the apex. The more scientific way of doing it is to look at the patient straight on and draw a line that is 1 centimeter lateral to the lateral canthus. So 1 centimeter lateral to the lateral canthus, or the corner of the eye, and it intersects with the line that goes from the top of the nasal ali and intersects with mid-tragus. Okay, and when we do that, same thing on the other side, just turn for me. You're going to come very close to the initial marking you already made. Okay. And so oftentimes we're injecting the apex of the cheek, and then we're going to inject a marking along the zygomatic arch, a little bit more lateral and superior to give some lift that helps, especially if people have a little bit of sagginess in their lower face. So to locate the second marking, you're going to go along the orbital rim, and you're going to extend along the orbital rim and feel the suture line where it crosses over the zygomatic arch. So when you feel it this way, it's hard to actually feel it because you drop into the groove that is the suture line. You need to start rocking your finger in this direction, and you'll feel a little depression right in here. Okay, so you can come and mark that. And then we assess to see if there's any volume loss medially or any that needs to be filled, and then again medially and superiorly. So this would be the apex of the cheek. This is the second marking. And if you follow Dr. DeMeo, who is a plastic surgeon from Brazil, he talks about the MD codes, and this would be his CK1 and his CK2 position. Okay. The next thing you can do when you look at a cheek, because now you can look and say, well, I can inject this, but how do I know that the cheek volume is going to sit in the right place? So the other thing you can do is mark on what's called the beautification triangle. And the beautification triangle is outlined in a paper from Dr. Arthur Swift and Kent Remington called Beautification. And to draw the beautification triangle, you're going to draw a line that goes from the lateral commissure to the inferior tragus, from the lateral commissure to the lateral canthus, and from the lateral canthus over to the superior tragus. And then you're going to draw an idealized oval. And when you drop a line from the top of that triangle, 90 degrees down, and it intersects with the line that you already drew from the top of the nasal ali over to mid-tragus, then theoretically the apex is right here. You can see in all cases, whether you do it the cheater's way, whether you do it the 1 centimeter lateral to the lateral canthus, or whether you draw out the beautification triangle, you can see that your apex is basically in the same spot. In addition, what's nice about this beautification triangle is, especially if you're using a cannula, you can do your insertion point of the cannula here, and you can see exactly where you want to fill in this beautification triangle. You can leave the markings on exteriorly while you're injecting or inserting away from that site.